This program is a Warren Steibel production in association with South Carolina ETV. Funding for Firing Line is made possible by a grant from the John M. Olin Foundation, the Annenberg Foundation, the Laurel Foundation, the Friends of Firing Line, and the people of Glaxo. In the relentless search for answers and medicines, on the brink of discovery, Glaxo, Research and Medicines.
Now on to number 2, part 1 of our exploration of the healthcare question, and I will continue to rely on Dr. Goodman to intercede when he feels like it. He's the president of the National Center for Policy Analysis in Dallas, and will give us hands-on help with our panel of egregiously qualified experts. You will perhaps recall that they include Congressman Jim Cooper, Tennessee Democrat, Rhodes Scholar, Harvard Law School, managed competition champion, Jackson Farris, president of the National Federation of Independent Business, Republican, Senator Phil Gramm of Texas, a Republican who sponsors his own health program, an economist who taught for years at Texas A&M, Dr. Walter Zelman of the Department of Health and Human Welfare, whose doctorate from UCLA is in political science, and Congressman Pete Stark of California, an MIT engineer turned banker, who has served 22 years in the House. In our first session, we covered much ground but left many points insufficiently examined, and I'd like to begin by asking this question. When you talk about competing systems, presumably this competition will have to do with how the insurance sponsors manage economies. There are, of course, 2 ways to economize. One is by having doctors and nurses and hospitals do things well and economically. A second is to have the consumer be less than profligate in his exploitation of those resources. To what extent now, since we're going to focus a little bit on the subject of the consumer, to what extent does the existing plan call on the consumer to take precautions not to overspend?
We need a lot of reforms along this line. So many poor people especially treat the hospital emergency room, the most expensive care provider in the world, as if it were a family doctor. And they are seeking this care oftentimes too late, not only for humanitarian purposes, there's oftentimes a needless injury or illness, but also it's too expensive to pursue this route. There's a better way to do it. We need everyone to be in touch with a family care advisor so that we can treat the bad cold before it turns into double pneumonia. We also need cost sensitivity. It's awfully easy to demand the MRI for the headache if you don't have to pay any of the bill, whereas you'd be happy with 2 aspirin if you are paying part of the bill. Cost sensitivity is an important part. We don't want to be unfair to people. We want health care to be affordable for all, but we can build back into the system a lot more cost sensitivity than is there today.
You mean build back in to an extent that the Clinton proposals do not?
Well, they have a lot of the cost sensitivity in the system, perhaps not as much as I would like to see. But again, it's important to stress where both political parties can come together. Democrats and Republicans have been fighting for half a century on this issue. Now's the time to come together in common agreement on what will work, what will be good medicine back home for all. We need a legitimate debate. This isn't going to be decided by the White House or by Congress this year. It's going to be decided by people back home around their kitchen tables as they figure out for themselves, viewing TV shows like this, what will work for me and my family, what will work in our little town. That's the key to this debate, and I think they're entitled to see all their options and to guide our choice to help us see whether they
want.
Well,
Mr. Stark, to what extent does Medicare provide the incentives that we just finished talking about?
It provides it quite clearly. It is not very generous, so that probably 70% of the seniors go out and buy private insurance to supplement, and they shop for it, and it costs a lot. You see, I can solve this. I can agree with Phil and Jim and Dr. Zelman and say all we have to do is everybody has to stop Band-Aiding. If they all believe in competition, Phil's willing to compete with Jim, I am too. All I want to say is if there's no other plan around, let me sell Medicare to a private patient at no cost to the government Is that at my cost? So let me in the ballpark as well. Let me compete with Phil's plan, with Golden Rule Insurance in Indiana. And then for the people who are disadvantaged, they're in rural East Texas, or there's in the inner city in Washington, D.C., where they can't get insurance, Medicare can be sold or supplemented if they're poor. All I ask is, all these competition wonks don't want to let me into the game. And I say, I'll let you in if you'll let me in. How about that?
Senator,
Welcome to the club.
does your plan tolerate a self-abuse in the sense of people, because they want to shrink from that deductible, not taking that mammogram or whatever it is that they ought to do?
You know, Bill, it's very interesting. The president talks about preventive care, but yet if you get up in the morning and jog around the block to get healthy, you pay the same insurance premiums as some slug who stays in bed.
And smokes.
If you don't smoke, the guy who smokes pays the same. The guy who drinks excessively pays the same. One of the principles that my plan is built on is that people who have healthy lifestyles, people who watch their weight, people who don't smoke, people who get prostate exams and mammograms ought to pay less. The president's plan is based on the premise that everybody ought to pay the same amount. Secondly, when you have a medical IRA, so that you have a savings component and an insurance component, the insurance component is going to be cheaper if you practice sound medicine, if you have mammograms, if your children get their vaccinations. So the president talks about preventive care, but in terms of incentives of individuals, he eliminates their incentives by eliminating the fact that if somebody practices good health, they pay the same amount as someone who doesn't.
Let's understand.
They don't.
Do I understand that the doctor's going to call in somebody who applies for health insurance and say, I'm going to give you an exam, and that exam shows that as a result of self-neglect over the last 20 years, he's got a little of this, a little of that, and the other. Now, is he going to charge a higher premium given that, or is he going to say simply you have a higher deductible? And how do we handle the problem of people who we want to look after even though
Okay,
they smoke?
let me say where we agree and then get to your question real quickly. We all agree that we ought to have some way of helping people with pre-existing conditions. I do it through a risk pool. The administration does it through collectivizing insurance. Secondly, we all agree we ought to help the working poor get insurance. I try to help people get a stripped-down Chevrolet. The administration gives everybody a gold-plated Cadillac. Martin Feldstein says their program is underfunded to the tune of $120 billion a year and may bankrupt the country. We agree on making insurance portable and permanent, so it can't be canceled if you get sick. Where is the disagreement? The disagreement is about the fundamental issue: how do you control cost? The Clinton administration says you do it by collectivizing purchases where the government is the only buyer. Well, the Defense Department's the only buyer of defense goods. Do they eliminate red tape? Do they eliminate duplication? Do they stop cost overruns? I mean, is this a joke or a public policy?
In the last program, we were told that there was only 2.5% administrative overhead in Medicare. Do you challenge that figure?
Well,
And
just
we have
remember
lower
two
costs.
things about Medicare, and I want Pete in this debate because I want a debate. But there are two things you need to remember about Medicare. Number one, Medicare is shifting about 30% of its cost to private health insurance, and that's one of the reasons we're here debating
But if we
rising
control
costs
what
of
we pay
medical care.
doctors and hospitals, that would stop.
The second problem is Medicare is growing at double digit and rupturing the budget. So I think that there are things we can learn from Medicare, and at least Pete is talking about something that has existed. The administration with these purchasing collectives is talking about a five-legged animal. Maybe they work, but isn't it funny we don't see any in
You can
nature?
talk about collective, Senator, but it's terminology that maybe throws people off. Right now, what we have in our healthcare system today is tens of thousands of small employers and mid-sized employers out there begging insurance companies for policies, trying to prove that they're young and healthy, finding that if they're not so young and they're not so healthy, regardless of whether it's smoking or alcohol or cholesterol or just bad luck with cancer and heart disease, their premiums skyrocket. So we have to do something about this. You asked about prevention. The Clinton plan deals with prevention in a number of ways. By giving everybody health security cards so that everybody has care, we're not going to find people visiting emergency rooms inappropriately, either when they're too sick and they should have been seen earlier, or when they have a cold. We're going to find that those things that are cost-effective when done on a preventive basis, like a woman seeing a doctor before she gives birth, or a woman getting a mammogram, or a man getting a prostate check, Those kinds of things are going to be built into the benefits package.
Well, but let's look at-
Today's insurance
let's look at
companies do
those
not build
benefits.
those things into the benefits package.
Let's look
You
at
have to
the-
pay for those out of your own pocket most of the time,
But let's
so
look at-
people aren't getting good preventive care.
Let's look, Dr. Zelman, at how you do that. You take people's money from them, and then you tell them how they can consume health care. And the plan says that a woman in her 50s can go in and get a mammogram with no out-of-pocket payment, but if she's in her 40s, she doesn't get the mammogram. She has to pay out of pocket if she gets it at all.
No,
You
I think
tell
the
a
rule
mother
is if
with-
it's
just a
medically
second, you tell-
appropriate, she does get the mammogram.
You tell
You're
a
inaccurate.
mother,
requires it.
tell a
That's not
mother,
correct, John.
tell a mother with a child that the whooping cough vaccine, no out-of-pocket payment, a flu shot, she has to pay out of pocket. Is this not incredible micromanagement from Washington, and why not give patients and doctors the ability to make a few of their own decisions?
I hate to
in this
defend the
area?
administration, but that's what every other insurance company does now under managed care plans. Aetna will do the same thing too. You got to call some nurse or some clerk at night and say, "Can I go to do this?" And they'll say no, and then you got to pay for it out of your pocket.
You don't see
so that's
anything-
no different.
you don't see anything
Except
wrong with
Medicare
that?
doesn't.
The point is, though, with them, you have a choice.
No.
With the government, you're not
Not
going
with
to have
Aetna
a
or
choice.
Pru. If they say no, you got to pay for it out of your
No,
pocket.
but you can leave Aetna. You can't, unless you
No,
go
you
move to
can't,
Mexico.
because if you have a pre-existing condition, you would be wandering in the wilderness
but,
looking for
most
insurance.
again,
the rest of your
employers
life.
only
What
give you
we're
one of two
seeing here
choices.
is an effort to fall back on something we all agree on. We all agree we've got to deal with pre-existing conditions. We all agree that we've got to find a way to help working people get insurance. That's agreed to. The question is, once we've done that, do we want to collectivize medicine in America? And you talked about me calling it collectives. You call it, your new phrase is
Health
alliances. But where did you get the term alliances? You got it by spending hundreds of thousands of dollars on polling to find names that mislead
Senator,
people.
I don't know where we got the term alliance.
We all know what a collective is.
I don't know where the term alliance came from, but right
came
now
from a
we have
poll.
tens of thousands of small groups out there purchasing insurance. Small employers are now paying 30 or 40% overhead purchasing insurance. They are incredibly inefficient,
And
non-expert
everybody
purchasers of health
says,
insurance.
let them pool purchases.
So we want to pool them, and we're going to give them an opportunity to pool. Now, some would say, let some pool with some and others pool with others. Let a free market reign in that respect, but we know what's going to happen if we do that. Those that are young and healthy will pool with those that are young and healthy and try to get better rates, and those that are older and sicker will get left in another pool with much, much higher rates. We want to
explain
look
your
at
risk.
all of
You
us
have risk
as a
adjustment,
community.
Walter. Why don't
Yes.
you explain how that works to us?
We do have a risk adjustment basis so that the plan that enrolls ends up enrolling a higher cost group of people will get a higher reimbursement so
How
that
do you
they're not
determine that?
encouraged.
How do you determine that? You have a
The
system?
government's going to determine.
Oh, there is no system
Bill,
for it.
that cuts
There are a
right to
number
the
of
heart-
systems
that
being
cuts
developed
right
now.
to the whole debate. The small business owners, their employees and families are tired of hearing, with all due respect, Democrats and Republicans arguing over who's going to win, who's going to lose, what difference will that make on Election Day. We have to have health care reform, but not at the expense of having the government tell us what insurance will be and will not be, control every detail of our life.
But
This
just
providing
a minute,
security,
Jack,
excuse me,
come on,
Congressman, this providing
let's get
security
these small
is the
business
person
guys
who
in their
can
proper
provide-
perspective. Your
Thank you very
members
much.
had a
Thank you.
poll, and 60% of them
Thank
said
you
they
very
would
much,
not
for letting me
support
finish my
health
comment,
insurance, even if they
Congressman.
had to pay nothing for it. So much for the generosity
Thank you very much.
of the
If I
small
could
business
continue,
person.
Bill.
Let's let Mr. Farris finish his
Thank you
thought.
very much. Part of
What
what we're
would they
seeing is,
He means keep quiet.
Be quiet.
Congressman, in your own state, Prop 67 was defeated by large margins trying to say an employer mandate. And I hope this quote on you is wrong. I saw a quote the other day that said that you think that small business owners do not have any social consciousness.
It's the ones who refuse to provide health insurance,
Did
even
you
if
say
it doesn't
that,
cost them
Congressman?
anything.
Did you- did you-
Absolutely.
did you say
I
small
said that a
business owners
small
have social
business
consciousness?
owner who will not provide insurance, even if it costs him nothing, obviously can have no social
Your
conscience.
figure's wrong there. The point about this being is it needs to be a nonpartisan agreement. One of the reasons that we've been working and supporting what Congressman Cooper's doing, what Governor Childs in Florida's been doing, Senator Chafee's been doing in the Senate, is let's come together on what we can agree on. Let's lock in on what we can agree on. Let the free market economy work. But let's not have the long arm of government dictating who pays the long arm of government. We have never had success with that in small business. In a small business, that's a person, when she goes to work in the morning as an employer, she knows the names of every employee's children. This is not some faceless person that the congressman's trying to paint as some person who's greedy and not willing to provide insurance. They'd love to provide
My
it. It
experience
gets
with most small
canceled. It
employers
costs
is
too
that-
much money. Let's read this debate. I hope
My
Bill will
experience-
focus
I gotta
on
understand
a
something.
result.
Did you say there are people who, even though it's of no cost to them,
The
will not
NFIB did
Yeah.
a survey, and they said, would you support being required to offer health insurance even if you had to pay none of the cost? 60% said no.
Because,
Well, that was
no,
part of it.
because they
Time out.
reject
That's
the
my,
premise.
that's my numbers you're using.
Yeah,
And I'm
in a
glad
poll
you
in
said that.
1992.
I'm glad you said that to me earlier because I was able to call our office to double check the mandate question. And your question that you phrased is wrong. 67%, to get accurate, 67% of those people who are members of NFIB, the over 600,000 nationwide, said that the biggest thing keeping them from providing insurance is cost.
Correct.
The reality is we've
That-
got to have a
that
system that
question
works.
was asked at a May 92
I'm sorry,
poll,
Congressman,
Bill.
your
I've got it.
figures-
I
Your
think
figures are wrong.
we can agree on
Well,
this.
why
I
would
think
anybody say that?
there is a real critical issue. First
I mean,
of all,
I- do you
I want
understand?
That's ludicrous.
I
It's
want to
just a
second
ludicrous
the
statement.
bipartisan
One at a
flavor that's
time,
I'll tell you
one
why
at a
they
time,
can say it.
please.
It's complicated.
Congressman.
They don't want to fill out the forms. I don't blame them. But
Just let the
if you-
government
if
do
you,
it.
if
No,
you,
no.
if
Well,
the
there is
forms
a
are
cost if
simple,
they have to fill out
No, but
forms.
Mr.
no,
Buckley,
they-
two-thirds of
assumedly
small
they
employers.
would be reimbursed for that.
It's important to realize most small employers today do insure their employees. Two-thirds do insure
Excuse
their
me.
employees.
No, wait a minute. 45%, excuse me, your
Your
figures are
own-
wrong.
Mr.
45% of
Motley
all
on
employers.
McNeil-Lehrer in March said
45% of all employers
62% of
are the
small employers.
NFIB members.
All right.
Excuse me.
All right. Well,
Of those
Bill,
people who
let's not
employ-
argue
to
which
fighting
group.
No, let's argue
I agree.
because you're using the
let's
wrong
look.
Let's all
facts.
make up our
Please.
numbers.
Let's
That
look at
way
the
it's all
bipartisan
works
45%
out.
is a geo.
I think the important thing to
study.
realize here, though, is that most small employers probably want to insure their employees, and I think you're absolutely right.
Our
The
figures
problem
show
is they can't afford it.
agree on that.
So we have to change the system so that they can afford it, and that's what
Why
the
don't you lower
Clinton
the
plan is
taxes?
trying to
We
do.
agree on that.
There are a
Why don't you
lot
lower
of
the
different
taxes?
ways. There are a lot of different ways to do that, but we think the way to do that is to allow everyone or have everybody pay, but to give very substantial discounts
So, well, you-
to
I think
those
you
small
do
employers,
agree-
especially those smaller,
Yeah, but
low-wage
doctors, we
employees.
found
wait a
that
minute.
subsidies
Let's-
come and go and mandates last forever.
Do I understand that everybody here agrees that the federal government has the right to impose on any businessman the obligation to insure people who work for him for health problems?
No,
I disagree.
I
Has that
disagree.
right, I
We
presume,
disagree.
but I don't know.
Yes.
is
I
anybody
disagree.
Of the 4 or 5 leading bills in Congress, there are only 2 that really impose an employer mandate. One is the single-payer approach, and the other is the administration approach. But we think that we can even come to terms with this. Perhaps if you have to have a mandate, an individual mandate, such as Senator Chafee suggests is a better way to go, but we really prefer no mandate
Yeah,
at
it's
all.
so-
Okay,
Medicare is a
may I
mandate.
modify that? Would all of you agree that there is a right of the government to require employers to impose a catastrophe coverage?
We think that would be the wrong way to go because a lot of people would end up with huge deductibles they wouldn't be able to afford. And it's a sham. Those policies that have been sold and marketed in many states find people don't buy them. They don't want policies with $1,500, $2,000 deductibles.
Your plan requires a catastrophe.
Well, my
insurance.
plan basically does this. My plan gives the basic worker, and most people buy insurance through their employer. Let me just take a company, Flat Stationery in Mejia, Texas, 20 employees. Under the president's plan, their insurance is canceled. It's illegal for them to go out and buy insurance directly. They have to buy through this health collective that would probably be in Waco or Austin, and they can only buy what is available. Under my plan, they would have at least 3 choices. One, if they're happy with Blue Cross Blue Shield and they're happy to pay the premiums, we don't tell them in Washington it costs too much and you ought to get out of it. We let them keep it. Secondly, they can take the money Flat Stationery is putting into Blue Cross and Blue Shield. They can go to Waco and buy into an HMO. Or finally, they can take the money their employer is putting in the plan and they can buy a medical savings account. Tommy Flat paying $4,500 a year for health insurance. He's 45 years old, 2 children, spouse. He could buy a medical savings account with a $3,000 deductible for $1,600 in Texas. He could then put the other $2,900 he's spending in a medical savings account out of which he could pay the deductibles on that catastrophic policy. Only at the end of the year, if he doesn't spend the $2,900, he gets to keep it. 92% of Americans don't spend $3,000 a year on health care. So for Tommy Flatt, if he opts for this option, we have put him back in the conventional grocery store where he is looking at cost. He buys hamburger a lot, but he can buy steak if he feels he needs it. That is a fundamental difference between what we're doing and what the administration.
Problem is,
but what if he gets fired and loses his policy and goes to another company, and before they agree to insure him, they find out that he has some signs of cancer?
If he gets fired, we have an 18-month grace period where if he continues to pay his premiums, he's covered. If he ends up with a condition where he is at risk and his premiums are over 150% of the norm and over 7.5% of his income, he goes into the risk pool. So we deal with it, but the point is this: the administration desperately wants to collectivize medicine. So they see a problem.
Senator, let's stop.
They see a problem,
I would suggest,
and so they say the only solution is to let the government run the system.
I don't think that's our answer, but let me say this. We agree with you wholeheartedly if your goal is universal access and security for all, and let's agree on that as a starting point. The second point I would raise is you use the analogy of hamburger and steak. The individual has the choice of hamburger and steak. What we're concerned about is what's the quality of that hamburger and steak going to be in 5 years, and what is the cost of that hamburger and steak going to be? It's not going to be much of a choice if we don't find a way to reform the insurance system and improve the competition so that we really get better choices for individuals as opposed to the same choices and increases of 10 and 15%
but isn't it
a year.
True, Dr.
So we've got to watch the quality and the cost of that steak and hamburger.
Zelman, you want to take choices away from people. Under the Clinton plan, a family can pay out of pocket as much as $3,000 a year, correct? But you tell the family how they've got to pay it. It's got to be a $200 deductible, 20% co-payment, and give them no options. Senator Gramm's plan gives them options. They can make the co-payment smaller, the deductible higher. We can let the market determine what's the best insurance relationship, right?
We think it's a wise idea to give everybody the same comprehensive benefits. If you look at the great majority of insurance plans today, you realize they're very, very similar. They differ only on the bells and whistles. But it's the bells and whistles that the insurance companies use to lure in certain people and to keep out certain people.
So you've decided the way it ought to be and no one else could possibly have a better idea?
We think if we give everybody a comprehensive choice of benefits that covers truly just about everything they need, then we will be able to force the insurance companies to say, what is your price? Let me finish this point. What is your price for that benefits? Not what is your price for A over here and B over here and G over there and 16 over there so that we have 100 different prices for 100 different benefits. Give us your best shot. Give us your price for the comprehensive benefits plan and then let the individual determine who's giving me the best price and the best quality for the same plan. Then we'll really have competition in our system, and that's what we're trying to get to.
Yeah.
Here's the problem with this standard benefit package written by the government, which is the heart of your plan. It's a one-size-fits-all, and so what it means is that it's too big for everybody except the person with the biggest feet.
Or too small.
Or too small. Secondly, what was totally predictable has already happened to you. You started out with a fairly modest, reasonable standard benefit package. The United Auto Workers said, Mr. President, we're not going to support your plan because we got a better deal. And what did you do? Well, we'll take your plan. And then last week, women in Congress said, we're not going to support your plan because you don't have enough of what we want. What did you do? You took what they wanted. We already now have a gold-plated Cadillac, and we hadn't even got to Congress. If you look at states that have a minimum benefit package, they require things like payment for sperm banks, hair pieces, marriage counselors. Any provider with a letterhead is going to end up being covered. And a little school teacher in Bryan College Station that doesn't smoke, much less use drugs or alcohol, is going to end up paying for a massively expensive rider for alcohol and drug rehabilitation.
The senator is very good at partisan fighting. He's neglected to tell us all that about 24
I'm not talking
Republican
about
senators in the U.S.
Democratic
Senate
Party
are with Senator Chafee in this issue, and they support a federally defined standard benefits package. 24 current sitting Republican U.S. senators. So Senator Gramm, with all due respect, is at the far right wing of the debate. He is making some valid points, and Medisave accounts are a good supplement to health care reform, but they are not a substitute. Mr. Zelman here is reaching some of the fundamental issues of health care reform, as the administration is. We've got to discuss these issues in a sensible fashion, not a demagogic fashion. It's too easy to lapse into the anecdote and the quick example.
But don't you think that he is trying to reach into a common repository of philosophical priorities? If we decide to take over the nation's health, the first thing we do is outlaw liquor, outlaw tobacco, do all kinds of things, make people jog every day.
Go back to Medicare. Yeah. Remember, everybody over 65, I hate to be the Energizer Bunny here, but we don't outlaw any. My mother's, we probably should outlaw some things for my mother, but it works. Now, it's a system that has been there 28 years, and it's the only system we're talking about that anybody's tried and we have actual numbers on. And I say, couldn't we build on that?
But Pete, you've gotten off light in the debate. With all due respect, on a scale of 1 to 100, with 100 being the best benefits package with minimum copay, Medicare doesn't even fit on the scale. It's down at the rock bottom.
It has the same benefits.
Third,
It's just
fourth.
The problem is you hadn't paid
Yes.
for your package, Jim, and neither is anybody else.
Yeah.
My package
Medicare
is
is
at least
paid
paid
for.
for. May I respond
Our
to Jim a
package
minute?
only costs
Jim, you
$25
remind
billion
me of a guy
a year.
who's in this debate that says, well, John, that's good. Bill, that's good. I'm not talking about partisanship. I hadn't mentioned the word Democrat or Republican this whole debate. I'm talking about
How many
values.
Democrats are on your bill?
I'm talking about
How many Democrats are on your bill?
I'm talking about values.
0.
Well, that's exactly right. But they
many
will be,
Republicans
by
are
the
on my
time
bill?
this debate is over, by the time people understand
Which
the
is
problems
right
with the
now.
benefit package, there are going to be a lot of people who are going to reject a state-run system.
And Bill,
Thank
let's
you
debate
very much.
ideas. Demand
Thank
health
you
care reform
very
without
much,
political
gentlemen.
reform.
Thank you.
Next week on Firing Line, the healthcare mini-debate continues with host Bill Buckley and a new group of experts. Funding for Firing Line was made possible by a grant from the John M. Olin Foundation, the Annenberg Foundation, the Laurel Foundation, the Friends of Firing Line, and the people of Glaxo. In the relentless search for answers and medicines, on the brink of discovery, Glaxo, Research and Medicines. For information about a video cassette of this program, write to Firing Line, 2700 Cypress Street, Columbia, South Carolina, 29205, or call 803-799-3449. That's Firing Line, 2700 Cypress Street, Columbia, South Carolina, 29205, or call 803-799-3449.